They are unlawful and irrational. That's the view of trade union Solidarity over the extended COVID-19 regulations. The new rules published in the government gazette include limitations on the size of indoor and outdoor gatherings and affirms mask wearing except in outdoor spaces. Solidarity is now taking action against the Health Department, writing a legal letter to Minister Joe Phaahla. To discuss their position is Connie Mulder, head of the Solidarity Research Institute. Mr. Mulder, good evening to you. Welcome to the program. What are you asking the minister in the legal letter?
Good evening, Iman. In the legal letter that has since changed into we're now going to court, basically, we just asked the minister, how did they come to the decision for the regulations that they published? We're in an extremely grey area legally at the moment. We've published regulations, but we've extended the comments on regulations, so we have no idea what we're commenting on. We have no idea where these regulations come from that are now published. Are they the regulations that was published on 15th of March that were trimmed down? We're talking about temporary regulations, but there is no such thing when we're talking about health regulations. These are permanent health regulations, and it's that what we're really uncertain procedurally where we are. And we're quite disappointed, actually, in a government that once again seems to want to govern by ambush, publishing regulations at 11 o'clock at night that come into effect 1 hour later, that have far-reaching implications for South African citizens and their livelihoods. So that's the one aspect. The second aspect is then substantively on the regulations themselves, where we're not going to go into the irrationality of specific regulations thus far, but the one thing that we can go into that at length later, but the one thing that really bothers us is that the criterion for these regulations to be enacted is just arbitrarily the minister deciding to address the spread of COVID-19. Now, the reason we're focused on this is that you cannot regulate a virus away. A zero COVID policy is not going to work. All regulations under the state of disaster has been to preserve healthcare's capacity. So we would expect that you would say healthcare is under pressure, now we need these regulations. The space for abuse is just massive. If we're talking about just addressing the spread of the virus, that means the minister can enact these regulations if there is any COVID case and is a bit worried about the spreading. But we're going to have COVID for realistically, I think the rest of our lives we're going to have a degree of COVID somewhere. And that worries us immensely. Is a minister should not be able to plunge the country into lockdown level 1 when we've got empty hospitals but a couple of COVID cases. And that is what these regulations unfortunately also enable.
Since you raised that, and as you say, it's now transitioned from being a legal letter into actual court action, I just want to clarify, I may have misheard you, whether that has actually been initiated. And then following on from that, you probably have heard that AfriForum has also announced its intention to go ahead with court action against government. Is there the likelihood that you might join their legal bid?
So it's initiated means we consulted with advocates and they're busy drafting the papers, and we should, well, they're working around the clock, so I'm not going to supersede them, but we are definitely going ahead. We can't have a situation where the Minister of Health can put the country into lockdown at will. AfriForum is busy with a separate legal process, and we'll see if the court decides to join those two. I'm not at liberty or I'm not at power to say that we're going to join or not. From our perspective, we're going ahead with our legal action, which says we think these regulations have been procedurally flawed, and we're really worried. When we read through them, we can see that these were hastily drafted. They weren't thought through simple things. For example, we had an exception for children under 6 with mask wearing thus far through the whole pandemic, but there's no exception in these regulations. So suddenly, every person everywhere, including babies, should now theoretically wear a mask. And then it's now health regulations. So where we decriminalized mask wearing during the state of disaster, and suddenly you can now face imprisonment or a fine if you do not comply with these. It's been a real, the government has been caught completely unawares. And that is the thing that worries us. Is the one thing that was certain about a pandemic is that it will eventually end. And we seem to have been woefully unprepared for actually moving out of a pandemic back to what we can call a new normal.
Yeah, my next question really touches on a concern you just mentioned now. So the new closing date for public consultation and comments on the health regulations is the 5th of July. But you believe that based on how the matter has been treated so far, this is not a sincere move to include public opinion on the matter. Just share a little bit about why.
Well, if you, in the same media release and the Gazette, the government at the same time says we did not have time to actually digest all the public comments, So we've extended the public commenting deadline. They say July, but the Gazette itself says 3 months from the 5th of May, so that would be August, which is worrying. But then whilst we're still busy with the public comment process, we're publishing these regulations in any case, and they're coming into effect, which basically makes a spectacle of the public comment process, which says government was playing simply caught unawares. They weren't ready for the end of the pandemic.
Yeah.
And now we're going to have to once again go to court as civil society and to force the government to do the right thing in handling the pandemic, which is we need less regulations. We need, if we do at all, we need a much more decentralized approach to COVID-19. We've now learned lessons in 2 years that a national top-down policy just doesn't work, and it's not necessary. If we just look at masking, for example, we're of the opinion that there are certain high-risk spaces which most definitely would be at liberty to require masks, like hospitals, doctor surgeries, where it makes sense. But this theater that we have at the moment of going into a cafe or a restaurant, wearing your mask for 2-3 meters and then sitting at a table and not wearing it anymore, that just doesn't make any sense. It's irrational. And we're of the opinion we've now moved on. We're in 2022. We should be handling the virus with all the knowledge that we've gained.
Yeah. Aside from, as you say, what seems to be an insincere, public inclusion of public commentary in the way these regulations are drafted, one of the other concerns you have is the way the minister made his decision, you believe gives him unbridled powers. And this is a dangerous position for him to be in, or for him to be allowed to be in.
Exactly. What these regulations in effect do is the minister suddenly has power over every restaurant and theatre in South Africa, just for example. So if you're a theatre planner or a concert planner, your life is going to be a nightmare. As how do you decide how many tickets to sell when the minister can publish regulations at 11:58 that come into effect at 12 that says now you're down to 50% capacity? We just plain simply don't think the Minister of Health should have jurisdiction like this. Now, to explain, we're not saying you should do nothing, but the goal of these regulations should be to ensure healthcare has sufficient capacity. That means notifiable, communicable conditions or diseases we're notified and we monitor them. And then when we see that we're going to a situation where healthcare can't cope, then we enact a state of disaster or do something else that enables us to have special regulations. We should not be enacting state of disaster regulations in health regulations. This creates a situation where the Minister of Health suddenly has power over every single indoor space in South Africa, which just does not make sense for that to lie with the Ministry of Health. This is much more a function that should be under a state of disaster or a state of emergency even. And that's our opinion is if we see that hospitals are not coping, then by all means, then we need to once again go into a different legislative instrument. But this is not it. And this is just, it's hastily put together. It's a blunt instrument that's not going to do what it should do. And it just further erodes public trust in a government that should be trying to win back the public's trust in their handling of the virus.
Connie Mulder, thank you for your time. That was Solidarity Research Institute head. We'll continue to keep an eye on developments in that story. The Portfolio Committee